You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, don't let your fear of the dentist or your busy schedule keep you from having the smile you've always wanted. With us, we have, in fact, he's a regular on our show, and he's the one to watch, Dr. Art Molzan. Dr. Molzan, welcome to the program.
Thank you, Randy. Happy to be back.
Now, for people that don't know you, you specialize or focus on dental implants.
Correct.
And the very complex cases. People come to you, I guess their teeth are literally a disaster.
In many cases,
And,
absolutely.
So I don't want to speak for you, but who is a typical patient that you see?
Well, being a general practitioner that has a 33-year history of dental implants, we incorporate modern technology as well as sound foundational work to rebuild people's teeth back. Many people have kind of let their teeth get away from them.
Okay.
They don't, first, they may not, many are fearful, but many it's just, they just don't have the time. They're too busy and things start just getting away from them and they develop small problems. The small problems then cascade into larger problems until there's a point where they need to get everything fixed at one time.
Is it the fear of the dentist in most cases?
Well,
or fear of pain?
Fear of pain.
Or a busy lifestyle? Maybe they don't have
it's
a company?
Combination. It's a combination. First off, I don't like to go to the dentist. So,
Nobody
I mean,
does,
I know that if I don't, most people don't. So that's the beginning thing. But there's some people that are much further down the line as far as the fear goes. And they are afraid. I think there's literature out there that supports over 50 million people don't go to the dentist because of fear.
Now, this is something. So I guess less than about 5% of general dentists in the country do IV sedation.
Correct.
Is that correct? So you do
Yes.
IV sedation?
Yes, we do.
And is it safe?
Yes, yes. It's one of the safest ways to have dentistry done. What it does is it takes the fear factor off the table for the patient so that they can cooperate and allow us to fix their teeth and do the things that we have to do, and almost always in an accelerated fashion because they're cooperating. It's so difficult to do a good job of restoring or fixing a section of someone's mouth if they're all intense. Their epinephrine's up, their heart's beating, they're anxious. One, I don't do as good a job. And two, it takes me forever to get that job done. So then the patient's in the chair 3-4 times longer than if we utilize sedation. If we utilize sedation, the patient's relaxed, they're comfortable, they're floating.
So sedation is a huge part of your practice?
Oh yeah, we use, I would say, at least 50% of the time we're sedating our patients.
And you say there's like an amnesia effect.
Correct.
Where they don't even remember the procedure.
Yeah, the beauty of doing IV sedation is that we can control the level of sedation for the patient versus the dentist that throw a few pills in someone's mouth and hope that they're going to get sedated.
Okay.
So we have the ability to control. So many times I've had patients where we fix the entire, and earlier we may even show some pictures, where we fixed the entire set of upper teeth in one afternoon, and the patient, when we were done, got up and said, "When are you going to start?"
Really?
Yeah,
Okay.
when are you going to start? We're finished, we're done. They can't believe it.
So when you say things like you could do like 3 months or 6 months worth of dentistry in one day, what does that mean?
Okay, so just last week we had Ellie in and she needed to have her lower teeth fixed. She needed some implants on the lower left-hand side. She needed all the teeth thoroughly cleaned, and we did some laser surgery around some of her teeth, and we replaced the implants, we temporized and crowned all the other teeth on that side, and we accomplished that within a 3-hour time visit. So in one afternoon, normally in a practice it would take 1 visit for implants, 1 visit or 2 visits for cleanings, 1 visit for lasers, and 2 or 3 visits to do the crowns.
So you have your own, I guess, lab right there. You make the crowns?
Yes, we can
if
make
they
the
want
crown,
to wait?
we can make the crowns right in office. And sometimes that's the fastest way to go. Sometimes we'll send the crowns out in order to get a better color scheme or something like that. But as a rule, then we'll make them right there.
Now for these dental phobics, back to them again. Do you have dental phobics that after they maybe do one procedure under sedation, that now they're not afraid of the dentist and they come in and it's not a problem?
Boy, you've hit it right on the head. You can't believe how many of the patients we start with a sedation profile, and we'll do 1 to 2 visits with sedation. And I had one just on Thursday. It was a gal that I have sedated 3 separate times, and had done her entire upper teeth, and beautiful smile, everything. A lower tooth went bad, and she came in, and we were able to do it with just typical Novocaine local anesthetic. And you would have never, ever had that happen before. She was an absolute phobic. That's why she'd waited so long to get those teeth fixed. But we did it with Novocaine.
Do people say to you, I should have done this years ago? Like if I would have known about sedation?
Absolutely, routinely. I mean, once they've got started down the path of getting fixed, and the fact that it only takes 1 to 2 visits to complete their treatment, they're excited. They go, if I'd have known this, I would have had this done a long, long time ago. Particularly the people where we're giving them a new smile, where we're giving them a nice, fresh, beautiful, healthy smile. Those are the ones that are just
So you brought
ecstatic.
photos?
I brought photos.
So these are all sedation?
These are all sedation.
Okay. Oh boy.
Here's a fella who was afraid of the dentist. Teeth were obviously in a bad state, not touching, he couldn't chew. Obviously he wasn't happy with his smile. He's got the beard and the mustache to try to cover it up. The fella Dale does not smile.
Is this common, by the way?
Yeah.
'Cause that looks pretty extreme.
Well, it is extreme, but it is common. We see that on a regular basis. And
Because I never see it.
You never see it because they never smile.
Okay.
They either have a mustache or their hand is up all the time. They're always covering or hiding what's underneath there. And so in his case, with sedation in 1 visit, we were able to give him a whole set of new teeth.
I mean, he looks happy here.
He's happy.
It's a different look.
It's a different look. He doesn't even know how to smile yet. He hasn't smiled for so many years. His beard is trimmed a little better, but I mean, I think it's just he just didn't smile ever before. He's
So
getting used to it.
especially men, do you find that men put things off? I mean, because I don't even like going in for a cleaning, right? And I have pretty good teeth. I can imagine if you have bad teeth, are men worse? They just put it off till they can't even chew like him? You said he couldn't chew?
I think men tend to put things off not because of fear, but because they're busy or because of other problems, other things that are going on in their lives. With women, fear plays, I think, a much higher role. They're afraid, and that's when their teeth get away from them and they develop real problems.
Okay, so you go in. So what's it like? So they go in, you numb the area, you give them a little sedation, they feel like they're just relaxed or asleep? They're somewhat conscious?
We utilize conscious sedation. So before they get any injections, we freeze their hand, insert something, and then begin giving them medication, so that they're floating and they don't know what's going on.
So you monitor their heart rate, their blood pressure?
We've got a nurse anesthetist sitting there the entire time, monitoring their heart rate, their BP, their oxygen content. It's just like being in an outpatient center. It's a wonderfully safe procedure where someone's watching them and their health the entire time, while I'm focused on getting the job done in their mouth and getting
So like
things
6
finished.
months worth of dentistry, or what would normally take like 10 trips to a dentist, you could do in 1 day because of sedation.
Yeah, and also the time frame.
Makes sense.
In the time frame as well, it's not just 6 visits that would have to be spread out over 4-6 months, where there's a little recovery time between each one. We just get the whole job done in 1 afternoon.
Well, why doesn't every dentist do this, by the way? Because it seems relaxed.
It requires some additional training. You have to get certified, and there's only, like I think you mentioned, about 5% of the general dentists out there that have taken the training to become certified to provide that service of sedation.
Is it the only way to go? I mean, you couldn't practice any other way now? For these big, giant cases?
We've been doing it now. We've been sedating now for 30 years.
So you're not, I mean, people go to you just for that?
Oh, yeah. Yeah. We have people come in to have their teeth cleaned sedated.
I've had guys, when they got into IV sedation, they say, because of, once they learned IV sedation, that it made them better dentists. What does that mean?
Absolutely.
What does that mean?
There's no question, because you have patient cooperation. You don't have the patient twisting and turning and jerking and doing all those things. So it allows us, dentistry is a little bit of carpentry, where we're in the process of having to make things fit exactly. And the longevity of the smiles and the teeth that we make is partly construction work. And if you have someone cooperating, the job that we do is just so much better. I mean, so much better. The dentistry will last so much longer. You know, we get into lifetime dentistry.
Now, you're in your office, and this sounds like a big endorsement for you. People need to know I'm not on your side here. I'm just asking the questions. But you say that you have people that come in, and literally, they know already before they get to you that they've been told their teeth have to go.
Yep.
That they come in without teeth, or with teeth that have to be extracted, and they can walk out in certain cases on the same day with a full fixed set of teeth with dental implants.
Yep.
Is that right?
Yeah, and that's because we have everything right there. We have our CT scanner. It allows us to take the pictures, gives us the exact information we need to know about what to do, and we can work up a treatment plan right on the spot, and even in those days.
Now, you wrote a book.
Yes, we did.
Teeth in One Day.
Teeth in One Day.
With dental implants. What's this book about? And
Well,
you give this to patients.
Yes, we do.
You should give this to patients that watch this program.
Yes,
I'll put
it's
you on the
available.
spot.
Yeah, it's available.
Okay.
Just call the office and we'll send you one.
All right.
Not a problem. It's a book made by Matt and I because there's so much information out there that's not accurate. There's so much information out there that's confusing to the public. So this is written on an everyday patient level.
To lower their fears?
So they can
and
lower their
educate?
fears and move them down the line to getting something done that will make their life better.
Now, you teach other dentists.
Yes.
I mean, you spend a lot of time on that. In fact, your partner, Dr. Holtan, he has a nickname for you. It's something about, but you're kind of like a legend to him, he says.
Well, I don't know if that's
You're
good.
a very humble guy.
That's coming back to the old age thing again. So I've been around a while.
So you can't be too far gone to
No.
go to your office. There's always something you can do.
There's always something you can do,
And
it's
IV
surprising.
sedation just makes it happen.
Sedation just makes it so much easier. It just makes it an experience that allows people to step forward and have the things that they've wanted done, both from a fear perspective and for the busy guy like Ron. Ron runs 7 companies. He has no time to do these things. He said, I'll allow you to fix my teeth. I know they need it, but you have to be able to do it in 1 to 2 visits. And I go, we can do that. He goes, well, last 4 dentists I talked to said it would take them 6 or 8 visits and about 4 months. I said, well, that's not the case here.
So when I hear teeth in a day or same day dentistry, this is not a gimmick or lip service. This is real.
It's real.
I mean, you're doing it.
We're doing it every day of the week.
I want to thank you for coming to the show. Always a pleasure.
Thank you, Randy.
You're watching The Wellness Hour. I'm Randy Alvarez. We'll be right back. You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, according to my first guest, don't let your fear of the dentist or your busy lifestyle keep you from having the smile you've always wanted. With us, we have an expert on this topic, Dr. Matt Holtan.
Thanks for having me back, Randy.
All right, great. So we had you on the program before, but for people that don't know your practice, and today we're talking about sedation dentistry. Tell us about your practice.
Well,
Who's the typical patient, I should say?
We really don't have a typical patient, Randy. We're a restorative practice. We help people with any problem from one tooth to all their teeth. Both my partner and I, Dr. Molzan, are able to comfortably sedate patients, allow them to get a lot of dental work done in one visit, and because of the particular set of skills we have, we're able to do most of the treatment in one office.
Now, when we say things like you could get 3 or 6 months of dentistry done in just one visit, what does that mean?
Well, typically the dental implant process could take a long time to get done. There was multiple phases of treatment. There were multiple doctors involved. Anytime you have that type of complexity, time is not on the patient's side. In our particular practice, because both Dr. Molzan and I have the skills to do all those different procedures, we're able to accomplish a lot of things in a much shorter period of time. You're only seeing one doctor, and I think because of that, the total time of treatment is much shorter.
Okay, so with sedation, by the way, so on all the bigger procedures, they're sedated?
Absolutely. Most patients don't want to sit through a procedure longer than 2 hours if they're not comfortably sedated.
It was bad enough for a cleaning, by the way.
Absolutely. Cleanings
Right?
themselves
I don't even want to
are
be at a
uncomfortable
cleaning.
for 45 minutes. But when someone has so much work that we need to do multiple treatments just to get it done, Dr. Molzan and I are willing to sit down for 4, 6, sometimes longer hours, do all the treatment in one visit, and the patients, they're done. Day one, they can be done, depending on what they need done.
Now we should mention, okay, so you have this kind of everything under one roof. I mean, you make the crowns right there in a day.
Yep.
You have your own CT imaging.
Yep.
You wrote this book. You have this
new
book, Teeth in One Day.
Yep. So the teeth in
Is
a day.
this a gimmicky kind of a thing, or is
no
this
gimmick.
a new
It's
style of dentistry?
It's a revolutionary thing happening almost every day in our office. And again, when I get back to the scenario, the typical patient that's going to lose some teeth and be put in some sort of a denture potentially for a long period of time, we're able to remove any failing or bad teeth, or if they don't have any teeth, we're able to go directly to the implant process, and the same day they can get teeth and walk out and be comfortably smiling, so that there's never really any downtime.
Okay.
And
Is it true? I mean, less than 5% of all general dentists do IV sedation?
that's correct. Sedation is something that we've incorporated into practice based on a need scenario. People are afraid of seeing the dentist. They don't know what will happen when they're having the work done, and being able to relax them for an entire visit and have really no recollection of what happened or how long they were even having the work done, makes them a lot more comfortable, a lot more interested in having treatment done.
You know, your partner, Dr. Molzan, said that some people, after working, doing 4 hours worth of dentistry, or he says 6 months worth of dentistry, they wake up and they go, "That's it." I mean, they don't even know it was done.
Yep.
I mean, do you have that happen?
It happens all the time. I had a gal in last week who didn't really have time to go to the dentist and had lots of things that needed to be done. In one visit, we were able to comfortably sedate her. She got her teeth cleaned with the hygienist. We replaced a few back teeth on one side that she'd been missing for a long time, and we were able to fix her front teeth and give her the smile that she wanted. And all this happened in one visit. She was elated that it could be done in such a short period of time.
And there's an amnesia effect on certain people?
Yeah, what happens is when we're sedating the patients, the drugs that we use not only provide them with comfort during the procedure, but they also have some sort of retrograde amnesia. So some people don't even remember coming into the office.
Is that right?
And it's interesting because they're telling you stories, they're talking during some of these phases, and the next day, or you call them at night to check on them, they don't remember they had a conversation with you.
Okay, so you say there's like two categories: the complete dental phobics, right, and then the busy people, right?
Yep.
Like they own businesses, etc. Or they're just too busy. The phobics.
Yep.
Is there a big crowd of people that are that afraid of the dentist?
You know, especially in the area that we live, there's lots of more mature patients. And whenever you have people like that, they've had teeth for a really long time. And a lot of the people have spent 50 years without going to a dentist because their only experiences in their whole life, when they were a kid, the dentists weren't using anesthesia, sometimes weren't even anesthetizing the teeth they had fixed. So they went a lifetime without dental care.
They tell you this?
And they tell me this, and then they
Interesting.
believe that finally it's the time to get it done, and they wish they would have had it done 20 years ago. They said, I can't believe I waited this long because I didn't know this could be fixed this easily. So I have one gentleman who's been retired for 25 years, and he was eating on just a couple teeth in the back of his mouth. He really didn't think that his problem could be solved, and especially was fearful that he would have to go and go back into traditional dentures, and his problem would become worse if he saw a dentist.
Okay.
And we were able to replace his back teeth, and in just a couple of visits, bring him back to where he wanted to be. And again, his story was that he wished he would have had it done 30 years ago.
So there's a lot of people like that.
There's thousands of people out there that are looking for a solution and don't know where to turn, don't think anyone has a solution to their problem.
And there are a lot of, because you do IV sedation, Dr. Molzan said, you deal with very complex dentistry.
Yeah, the most challenging type of dentistry is when people are either losing all their teeth or they've already lost all their teeth. Typically they've lost the volume of the gum tissue, they've lost some bone. And most people have been told at some point in their lifetime that they can't be helped. Someone told them that they didn't have enough bone. We hear that every week.
Is that right?
And these are the people that Dr. Molzan and I specialize in treating. So we think that our method, whether it's all on four or it's traditional denture.
All on four meaning what?
All on four is a very progressive way to replace all of someone's teeth in one or both jaws with as few as 4 implants. Now, it doesn't mean it's always 4 implants, but most of the time it is. And it's a same-day teeth concept. People come to
So
us
somebody could go in with no teeth, and you say they could walk out with teeth.
that day, every time. So it's
Comfortably sedated?
Comfortably sedated.
Like what percentage are sedated?
100% of the people that we treat with the all-on-4 method, we like to sedate. And not
That's
because
4 implants.
4 implants per jaw. That
Fixed set
day,
of teeth.
they walk out with teeth that stay in their mouth. Their palate isn't covered, right? There's no flanges in the dentures, and the teeth are fixated. They can go out that night and chew really anything they want to.
Is that right? Why don't all dentists do IV sedation?
Well,
Because it
it's-
seems logical that it's easier. It must be easier on you to work on the patient.
It makes
Definitely easier on them.
It makes working on patients a lot more comfortable for the patient and myself. But it is a challenge. People have health problems. There's all types of things that come into my mind when we're deciding to sedate a patient. We work with an anesthesia team. Dr. Molzan and I like to focus on the patient and doing the dentistry. We have someone there in the room monitoring all the statistics, monitoring the patient's health, their vital signs and such, and they're focused on the patient while I'm focused on doing the work.
Interesting. But you are also certified and licensed to do IV sedation.
We have to be certified to do the sedation, but we have chosen to let someone else do the sedation while we focus on the patient.
So what's monitored, like blood pressure?
Monitored everything. We've got an EKG monitoring their heart. We have certainly regular vital signs, blood pressure, pulse oximetry, right? And they're looking at the patient. Sometimes this work can be so complex that I don't necessarily have the wherewithal to be focusing on everything that's happening with the patient when I know someone else is doing that for me. And I can focus on doing the work, because some of this stuff, as you know, we're trying to accomplish a lot of things. We're fixing lots of teeth, right? We want to make it look really good. And it's a complex thing.
So the patients, I was anticipating you coming here. The patient population, I guess, for dentists and medicine, they're getting older and older.
Yep.
So you get people coming in with a lot of problems. So how safe is this?
It's very safe. Randy, patients are getting older and older, but they're also keeping their teeth more. And as you know, 50 years ago, everybody had their teeth removed, they had dentures made. Everybody has a parent or a grandparent that had some of that stuff done.
Okay.
Well, these days we find that people are keeping more of their teeth. So some of the problems we're solving are in localized areas. It might be 3 or 4 teeth in one side, it might be 1 or 2 teeth in the front. Everyone's a little different with that. We have solutions that can range from fixing one tooth to fixing a whole mouth of teeth. And that's the beauty of the consultation, is that patients can come. It's a no-fee consultation. They can meet with us. We take a free radiograph, and we talk to them about their issues. Maybe they only want to fix some areas, and we can custom tailor a plan based on what they need.
Okay, and so what do you say to the patient watching this, right? And maybe they fit into the category of what you talked about. They've been in the dentist in many years,
right?
But they're a phobic. What do you say to them? What's that first consult going to be like? Take me through that.
So we tell the patients, come in, have a free evaluation, spend some time with myself or Dr. Molzan. It's a very casual visit. Sometimes I don't even look in the patient's mouth. Sometimes we just talk about what they want, what they need. Again, when you're dealing with a patient that's very phobic or hasn't seen a dentist in a long time, you have to treat them a little differently. You have to let them kind of drive the conversation. I ask a lot of questions. I take a lot of notes. I said, I want you to tell me what you want me to help you with. Just because I think someone might need something doesn't mean that's what they want. So a lot of times with these patients, we start off slow. We fix an area of the mouth. And if they feel we did a good job, they're happy with the way things worked, they were comfortable during the sedation, then we move on. And we have had people where we fix an entire mouth after things like that. So it can.
You say it can change their life, like life transforming.
Randy, fillings don't change people's lives, but when we're helping people fix an entire mouth of teeth, or we're bringing their smile back and rejuvenating it, people cry all the time.
Is that right?
It's a very typical part of our day is having people write us a letter or talk to us after we've completed treatment and say, this really changed who I was. So many people have learned not to smile over the years. So when you give them that back, you're not just giving them teeth, you're not just giving them things to chew with, you're giving them back confidence. And that, to me, is...
Do you see changes in them?
Absolutely. You see it in their eyes.
Have you turned around phobics? People that now supposedly like coming to the dentist, which I find hard to believe?
And again, when their only experiences were poor, one good positive experience can go a long ways. So yes, absolutely.
You do nitrous as well?
We do a little bit
I
of
like
nitrous.
the nitrous.
Again, when someone comes to me and they're...
For light procedures.
For light procedures, nitrous works great, and it can just give people over the edge. Again, if we keep them really comfortable with good local, right, and you do a good job of kind of talking them through what you're doing, people are almost always very, very happy.
Now, you're known for that, right? Dental implants and sedation dentistry.
Yes.
In your town.
Both Dr. Molzan and I spend the majority of our time helping people replace missing teeth and fix teeth that are broken down. So that's fixing smiles, right? Replacing lost quadrants or entire mouths of teeth. We spend a lot of time traversing the country, finding out what's the latest and the greatest, and I think having that background is essential.
Now, traditionally, like for wisdom teeth or things like that, you have to go to the oral surgeon or the periodontist that does IV sedation.
Yes.
They can go to you.
Yes.
You do those things too?
We do those things.
Okay.
They aren't the focus of the practice. Again, the focus of the practice is on restorative dentistry, giving people back what they've lost. But a lot of times to help people with those things, you have to have a background on some of those other procedures.
Now, I know you want to bring some photos, so we have about a minute left.
Randy, this is one of my favorite patients, Bob here.
Okay.
A lot of the people that come to us, they have an interesting story, and I like to hear the story. It gives me a background on where they are and where we need to be.
Okay.
Bob had been referred to me by another dentist. He had had multiple root canals. They'd left the root canal teeth in the mouth to support a denture along with some mini implants. And he wasn't happy. He had his palate totally covered. As you can see from his smile, it wasn't exactly what he wanted. And he's a happy guy. He's probably the most jovial guy we have in the practice. And his biggest thing was not looks, though. It was function. He wasn't able to eat the things he wanted to eat, and he thought that this was the end of the road. He didn't know where
So
to
he heard
turn.
about you guys
He heard
because of
about
dental
us.
implants.
He heard about us, dental implants. He's referred to us by another dentist, actually. And you can see here that this is just his post-operative photo. It's unbelievable. Look at his eyes. He's a happy guy. He came to the office the day after the procedure to personally tell the staff up front and me that he just had breakfast and he had pancakes, and he hadn't had pancakes in 15 years.
Okay.
I've never seen someone so excited about eating pancakes, but we were able to, in one appointment, to remove any of the bad.
And he was sedated.
He was sedated to remove any of the bad infected teeth, remove any failing mini implants, and we put in, I believe with him it was 5 implants, and that day he walked out with fixed teeth that stay in his mouth. You can see by the look, it's unbelievable, and you know, he's just a super satisfied
And they look
patient.
very natural, by the way, like cosmetic. Like, I mean, they look like veneers to me, or at least just really healthy teeth.
The goal with any of these solutions is not to let anybody else know that it's not the patient's real teeth. Now, we see people all the time that have beautiful white, you know, veneered teeth, just like young models, but even with a more mature gentleman like this is a natural look for him. They're not too bright, they're not too prominent, and again, that can be made any way a patient wants. It's really depends on their character and kind of what they tell me they want to look like.
I want to thank you for coming on the show. Great stuff.
Thanks for having me, Randy.
You've been watching The Wellness Hour. I'm Randy Alvarez. I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.